Welcome to RUMC Connections. Welcome to RUMC Connections. On this episode, we are joined again by Dr. Brian Gilchrist, pediatric surgeon. Today, on this episode, we're going to discuss some cases that are popular in the community. And could you please inform us a little bit about sunken chest?
Sure. The sternum, which is the breastbone in front of your heart, can either be protruding outwards, which is called carinatum, meaning pigeon, or it can be called excavatum, where it goes inwards. Pectus excavatum, where the sunken chest is seen discernibly by people, is a real problem, and people don't realize it. It's not a cosmetic issue, it's a physiologic issue. For instance, if you have your breastbone sticking into your heart, which it invariably does, or abuts it, you don't get as much cardiac output. Now, if you don't have as much cardiac output as a kid next to you, you can't keep up with them on a soccer field, you can't keep up with them on a basketball court, etc. So it becomes a real issue. So what do you do about excavatum? In the past, a lot of people thought it was a plastic surgical consideration, but it is not. If you do pulmonary function tests on kids who have sunken chests, their pulmonary function is much less than another, especially if you're using your arms, tremendously diminished from the normal kids. So in the past, we took out the breastbone. We took it out, put it on a table, we broke it. We took the 6 ribs that are connected to it, and we broke those. And it was a very long 5 or 6 hour operation and very bloody. About 20 years ago, a man by the name of Dr. Nuss in South Africa came up with the idea that you didn't have to do that anymore. And if you look at the history of orthodontics, people who have an overbite, you put on braces, and the braces that over time align your teeth in a proper manner. Same was true of club feet. Club feet used to be operated on numerous times, and then they came up with molding and modeling, and they no longer have to operate on them. So he said, I think I can do the same thing with the chest. So he took a bar made of stainless steel and slipped it underneath the sternum and popped it out like you do if you take a dent out of a car. And it takes about 30 minutes to do. It pops it out, and then you leave it in place for 2 years, just like orthodontics do for and then you take it out, and the breastbone is back to normal. And it pops out in a way now that doesn't impinge on your cardiac output. It's a absolutely elegant operation. He presented it at the national meetings about 10 years ago. And then when I was at downstate, I went down there to Virginia to learn how to do it. And I was the only person initially in New York who was doing it. Then when I went back to Boston to be the chief at Tufts, all the Harvard guys didn't do it. Remember, at Harvard, I got to tell you about Boston for a second. Boston is always about 10 or 15 years behind everybody else. They didn't do laparoscopy, they didn't do liver transplant, and they didn't do the Nuss procedure, because what happens in Boston is they're very, very conservative. They'll let all the guys in Texas or somewhere else, Virginia, do these things. Then they'll say, okay, looks like it's okay. Then they get people who come who do it better than anybody else in the world. There's real talent in Boston, but it's very conservative. So I was the first one in Boston doing them. So I was on the national list. So I was doing all these pectuses. And pectus is seen more in Northern European people than in other races. So you have to keep that in mind. But it's an elegant operation. It's minimally invasive, and you do it all with the scope. So there's no incisions, and the results are quite staggeringly good.
Do you see a lot of these cases on site?
Yeah, I see a fair few. I also see a lot of carinatum. So the carinatum is where you have a pigeon breast. You have a breast bone that goes out. And so now we don't operate on those. We used to operate on them and shave them. Now there's a remodeling. There's a mold you can put on, and they pretty much go away on their own.
Is this something that's identified by the parents or pediatricians, or like how does...
It's in school. You're in school, you're in a gym, and everybody's saying, oh, what's that? Kids are always making fun of kids. And if you have something that's looks like you got a hole in your chest, it becomes discernible to your parents. The kids become very self-conscious about it.
So it's literally like when you look at somebody and they have a dent in their chest.
That's right. Indented. It goes, and some of them go deep. So you have to get a CT scan and get the parameters, because these things can go way in, almost to your spine, or they can be out halfway. But they all impair your heart, every single one of them, just about.
And I imagine by Nation, when we actually talked about this before we were taping the episode, kids, as we know, put things in their mouths. We talked about money or pennies and things like that. And you brought up a fascinating danger that most parents wouldn't even think of when they find out their kid has put a penny in their mouth. And if you could just kind of explain that.
So the two things you want to take away from somebody who swallowed something is, first, was it a battery? If it's a battery, this is an emergency that needs to be addressed ASAP. You got to get them into the hospital. You got to get a scope in there, and you got to get these things out. The charge or the leakage from a battery can cause incredible corrosive damage to the esophagus. I mean, tremendous. So that is number one. Number two, if you have a foreign body of a penny, of course, we do this all the time in the OR with the medical students. It's a sucker's bet. You say, is it a nickel? Is it a quarter? Is it a penny? And of course, the magnification on X-ray is always 2.5 times. So it looks like maybe it's a nickel. So that the wise guys will go, oh, yeah, it's a quarter. And you say, $20 up, it's a penny. It's always a penny. So anyway, I don't do that to them anymore. I'm too old. When here's the real concept. If you have a penny or something that you think is a benign entity in the esophagus, get it out. The reason you want to get it out is if all of a sudden a kid gets hit in the stomach or is fooling around with their brother or sister, or they vomit, it can tumble up into your mouth and then end up in the airway. If it ends up in the airway, you can have a dead kid like that. So my teaching, especially with the residents who I teach every day, is get the kid an X-ray, find out where it is, and get it out. And I don't care if it's 10 o'clock at night or 2 o'clock in the morning, come in with a smile and get it out, because you do not want to have that catastrophe that could be easily averted by being diligent and quick to do it. And I tell I give these talks to pediatrics all the time. I say, if you're out in practice somewhere and somebody tells you they have something in the esophagus, and the guy doesn't want to come in, get yourself another surgeon. Get yourself ENT, GI, good pediatric surgeon. Get somebody who's going to come in with a smile and get it done, because you do not want to wait on these things.
Well, you talked about the danger of bleeding out from swallowing a penny. I mean, it's amazing.
So it's interesting. I mean, this gets back now to basic anatomy and physiology. The esophagus, of all the structures in your GI tract, is the most vulnerable entity because it doesn't have a serosa. The serosa is the outside membrane. There's four levels to all your GI tract. There's only 3 in the esophagus. So if you don't have serosa, which is like it'd be like your wallet wrapped around a straw. It should be that strong. You don't have that in the esophagus. So if there's something in there chronically that you don't know about, even over a couple of days, it can go right through the esophagus and burrow into the thing that's pounding next to it, which is either the common carotid artery or the aorta, depending on where it is. If it does that, you now have a tamponade. You've got something going through the esophagus into a blood vessel. So now if you pull it out, they bleed to death. So if there's any question that you have that, you need to take them to an operating room. You have to open the chest, get out the blood vessels, and do this properly, because if you don't, you'll have a bleed that you can't stop.
Aren't magnets another very dangerous object for children to swallow?
Magnets are dangerous for you too.
Yeah, of course, for anybody.
It's just, the fact is, what happens is you have one negative and one positive, and when they try to kiss, they might be kissing between 2 pieces of bowel, and now you've got a hole in the bowel. And then you have what's called peritonitis, and then you can get septic and die from it. Mm-hmm. So magnets are not something to mess with. If it's a magnet, you got to get them out. Mm-hmm. Yeah.
So I think one of the interesting things that you talked about the whole time is kind of the evolution and being at the forefront of a lot of this medical field in the industry and stuff. But I remember when I was a kid, my cousin would eat Legos all the time.
Crayons.
Right. Yeah. Like, no, just keep an eye out for it in the past. But I feel like everything you've talked about has had, in your lifetime, in our lifetimes, it's had tremendous evolution.
The technology, especially with the scopes. Now, when you put a scope in somewhere, I can take something that the size of a needle that you put in a vein and connect it to a camera now and see things like the World Series caliper. It's unbelievable what you can see. So that's made a huge difference. And that if you're trying to get things out of people, just the equipment that we have, out of the materials that are used, you just go down and you can grab it with a tiny pickup that has incredible strength, take things out that you could never do before. Some of these things you could grab your shirt and flee across the room and never injure the equipment. It's incredible because of the materials. And we used to say in Massachusetts, President Kennedy was the great advocate for the space program. It wasn't just putting men on the moon. The things that have evolved from the space program are a lot of these things that we use every day in medicine. they're magnificent because the materials are so good. It's so miniaturized now. It's a magnificent time to be in medicine. I mean, I wish I was 30 now, because if you're 30, I'd have 30 good years of going ahead with this stuff.
Well, and talk a little bit about your colleagues at RUMC in the pediatrics department, the surgery department. I mean, I imagine that there's just about any procedure we're doing at RUMC.
So let me tell you about RUMC. Remember now, I was at RUMC when it was St. Vincent's back in I was there 95 to 2002 before I got the chief's job in Boston. And I covered RUMC, St. Vincent's then, for Downstate, who employed me. And at that time, Peter Carpenito was just coming up as a staff guy. Vincent McConey was here doing vascular. And Scarlatta was here doing OBGYN. All names that are probably very familiar to you guys. And Peter, as he ascended in the organization, got around a group of people that are so talented in a community. That I come here into pediatric surgery with pediatric anesthesia people who are better than anybody I ever had in the children's hospitals that I was. You got Bonenberger and you got Rizzo and you got Fu. These three, it's like a treasure trove of pediatric anesthesia. And Peter somehow, because of his charisma, has drawn these people and kept them here. It's a testimony to the hospital. Also, there's nothing these guys fear. They can do anything, the three of them. So if people always ask me about anesthesia, mothers especially, it's the most important consideration I have. And I can tell them without a scintilla of doubt that I got the three best people I've ever worked with in my life here on Staten Island. That's how good they are. And the nurses, listen, these nurses, they can be tough. They can be tough, but they are so kind to the kids that it's just, they can be awful to me. But it's sometimes deservedly so. But to the kids, they are unfailingly good and kind. And they're so competent. And it's a funny thing. It's like, it's a community hospital in the middle of Staten. I put these guys in the NICU, our NICU, for year after year for the last 30 years, they've been as good as anybody in America with their numbers. They're still that good. So that you have a collection of people here. Brian McMahon is the head of pediatrics, probably one of the best diagnosticians I've ever known. He can look at a kid across the hallway and make the diagnosis. I mean, he's that good.
Wow.
We have some seriously good people. On a given night in our hospital, if you've got some of the senior people there and people from anesthesia, can't beat us.
And that's got to be a reassurance to you. You know the team. You're walking in and you've got superstars as part of the team. When you're going in, let you focus on what you have to do.
I mean, I would never do an operation in a hospital where I didn't think I had people as good as me or better.
And it's funny because we also do a television show called RUMC Vital Signs. We had a bunch of nurses on, and one of the nurses we had is a surgical nurse. And she was talking about how they have a book or a binder named for every surgeon that they have. So we'll say the book of Gilchrist. And it's got everything to his booty size, the type of glove size he needs, the music he may want to listen to. And it lets them kind of set the stage so he can focus on what he has to do. And I thought it was very interesting to hear how they have this book. They go over it with the surgeon. Is there anything that needs to be changed? But they know who's the surgeon, Dr. Gilchrist. They pull the book of Gilchrist out. And they get everything said. They know how he likes his instruments laid out. They know, and I'm like, that has to be so reassuring when you're coming in to do laser focus on what you have to do, but your team is like, we got this, don't worry about it.
Okay. So are there any emergent procedures that you see in pediatric surgery? I know you spoke in the last episode about this robot that is in the works with the smaller hands and everything that will leave a much smaller incision in children. Are there any particular procedures that you're
seeing? Well, when you talk about emergency procedures, of course, appendectomy is number one. But then number two, of course, are things like splenectomy. When a kid is injured and has a broken spleen, that's a very common injury in children. Now, the spleen, you can do two things with the spleen. If it's bleeding, you can either put a clamp across it and take it out, and then you're at risk for developing certain infections. It's always a danger. So what I do is I do a splinorrhaphy. I fix the spleen. So what I do is I get liver sutures if it's broken, and I sew it. And then I take a piece of omentum, which is the fat that's in front of your intestines, and I drape it up and I sew it to keep it like in a little purse so it won't bleed. So I do splinorrhaphies for trauma, and I have for years. It's not a very commonly done thing because most people haven't done it, but I've done a lot of them, so I do splinorrhaphies. The other emergency thing that we do, of course, so I'll just talk about the spleen. Want to talk about the spleen for a minute? Let me just talk about the spleen. The spleen is a fascinating organ. So the spleen is an immunologic organ. So if you're between 0 and 12 years of age and I take your spleen out, for the rest of your life, you're going to be at risk for what's called overwhelming post-splenectomy sepsis, OPSS. And that means that you cannot handle certain microbes. So if you get a meningococcus, if you're by H flu, you can die from this. Just 50% of the people mortality is, so you don't want to take these spleens out if you don't have to. So what evolved in pediatric surgery was the guys, there's gradations of splenic injury. So you take a punch to the left upper quadrant and you have a grade 1. You're on a bike, you get hit hard, it's a grade 2. You get hit by a car, it's car. There's different grades to the spleens and how much they bleed. So the teaching has always been, if you're not bleeding out, you can sit on these kids and they'll heal on their own, predicated on the grade of the injury. So that was sort of the evolution. In 1972, it was first recognized, but all the guys out in the communities used to say, I'm not doing that. It's too risky, especially if you're in a community where you don't have residents. So we have residents checking on a patient every hour. If you're out in the community and you don't have residents, you're taking a spleen out because you're not going to risk somebody bleeding on you. So that all evolved. And then what evolved from that was, well, Jesus, sometimes they lose enough blood, you got to give them blood. So if you're giving them blood, you might as well go in there and fix it because you don't want to give blood, especially prior to the whole AIDS thing. So people learned how to do splenorophies, go in and fix the spleen, especially you do not want to have a kid's spleen out if you can avoid it. So I learned how to fix them. So that's what I do. I fix them.
So later this summer, RUMC is going to be opening up its new surgical department. We're going to be having 10 new surgical suites up there. And I'm just curious, have you had any input in its design, what it's going to look like when it opens?
No.
No?
No, I just load the trucks. Dr. Messino, who's the CEO, he gave me a couple of tours, and it's magnificent. I mean, the emergency room now it's special. I mean, people love coming there.
Yeah.
I mean, I come in late at night, and it's just like, you're going somewhere special. It's just beautifully done. Mm-hmm. But remember, all these structures, it's like I took history classes in college in these rickety old buildings, and it was magnificent because the teacher, it's all predicated on the person. You can have a beautiful place and have a bunch of schmagagis running it, right. But you gotta realize it's the people that count.
It's very true. My family goes to RUMC. We've been there for different things, different procedures, and it's always been the people that pull us back. We live on the South Shore, so we will make that extra effort to go there because of the people and the care there.
Mm-hmm.
It's a special place. I mean, it's no longer a quote unquote Catholic hospital, but it has that Judeo-Christian sort of ambiance to it. There's a certain spirituality to the place, and it gets transmitted to the patients. And even the guys who are the leadership, these are very good men. These are very good people who run the hospital. I mean, it's not corporate. It's personal. It makes a big difference.
Given everything that you do every day to save lives, how do you decompress? What do you do in your time off to decompress?
I run every morning. Read voraciously. There's nothing I don't read. I read a book a week. And I live in the book, and I pray. I pray that I make myself a better person and more noble by doing what I do, because I'm filled with human flaws and weaknesses. And I think when you take care of the sick and the hurt and the disenfranchised, you become a better person. You become more noble. And my whole purpose in life, hopefully, is to be a better person and more noble.
And I'll ask you, because we ask this of just about every guest we have on this show, and every answer is different, and I find every answer fascinating. When you've made a difference, you've saved the life, especially the life of a child on the table, how do you feel?
I don't think that way.
No?
I never think that way. I don't want to think that way because it's not me. I'm just the instrument. I am. It's not me. I could say to you, listen, I'm the greatest goddamn surgeon ever. Listen, maybe I am. Maybe I'm the best that ever came to Staten Island. It's not me. I'm just the instrument. It all comes through me from somewhere. I don't know, whatever you believe in, but I believe deeply that every day God works through you. The corporal works of mercy. I'm an Irish mother, you got to take care of the sick, You know the story of the centurion? If they'd asked me to speak at Carpino's scene the other night, I would have told them the centurion story. The centurion story? It goes like this. The centurion is in battle. He's part of the 10th Legion, Caesar's favorite. They wore the red tunics. And he comes back and he's bivouacking in Rome, and he's out with the boys, and he's walking back to his barracks, and there's this guy out in the middle of the byway with a tin cup, shivering in the cold, and he takes a coin out and he puts it in, and he sees the guy shivering. He takes off the red tunic and he gives it to him. Off he walks. A month later, he gets killed in battle, and he's in heaven. And he says to God, how did I get here? I killed, I drank, I was a womanizer, I gambled. God takes him back in time. It shows him the beggar. And he said, when I was hungry, you gave me food. When I was thirsty, you gave me drink. When I was naked, you clothed me. Wherever you do the least of my brethren, you do unto me. And Peter Carpenito lives that philosophy, lives it. And there wasn't a person in that gathering the other night who hasn't been helped by him. And I've tried to do that every day of my life. And so it's not me. I mean, I am a flawed guy, but I hopefully have helped, especially these mothers, get through times with their sick babies. That I take care of them. I try to take care of them like they're my own.
So speaking on that, for a non-emergency case with a child, when you're approaching a surgery, how do you handle the child? How do you speak to them and try to explain what they're...
Well, I have to do this baby talk stuff because they can't stand. It drives me crazy because you know what? The baby doesn't have a clue what you're saying. Of course, when you have all the women, they all get together, or their voices go up one octave, and it's just, please don't do it in my room. But how I talk to them is I carry the babies myself, and I say to the mothers, I'll take care of him like he's my own. You try to let them know that you actually care, because I do deeply.
Do you keep relationships beyond the procedure?
No, never. They'll send me Christmas cards. Of course, I'm Irish, so they think I don't drink. I lost a brother to drink, so I don't drink at all. But they'll send me bottles of liquor. I mean, I re-gift them all. Don't tell it. I re-gift it. So if you give me a bottle, they give me a bottle of scotch, you might get a bottle of scotch from me.
Sounds good. Yeah.
But no, their connection is there. But I do not become friends with these people. I do not go to their homes. Sometimes I get invited to things, but I don't go. I had a kid die on me from a liver tumor in Kings County years ago, and I went to the wake. Biggest mistake I ever made. It's just everybody's mad at you because why didn't you save the baby? Why? You think to yourself, I'm not doing this again. You have to. It's like being in the military. You got to keep a little bit of distance from the guys you're sending into battle.
So where do you draw inspiration from to do what you do?
Meditations, Marcus Aurelius. I think my own concept of God in my life.
And what do you see for the future of RUMC now with this new surgical department? How do you think it will impact things on the island?
Well, I'm not involved in leadership here, and so I don't know I'm not privy to the inside financials and what's going on. But if you're an objective observer, this place is I was at NYU Winthrop when Winthrop was taken over by NYU. Winthrop was a magnificent hospital that was just superb for Long Island. NYU came in and just grasped it, but it's still a magnificent hospital. In this era of huge volumes and needing scale, small hospitals are going to have a hard time surviving on their own. But I think with people like Peter here and Dr. Messina, I can't imagine that we would ever be taken over and disbanded, turned into a rehab hospital. I think what they'll do is eventually they'll keep this as a separate entity, as a part of a constellation of other hospitals. But I can't imagine us staying alone forever. The place is too good. It's got to be too tempting for the big organizations now to want to scoop up. It's a truly magnificent hospital, and you don't get this in many places. NYU Winthrop was out of Mineola was superb. I was the chief out there for a year. It was superb, but it lacked the ambiance of this place, and it also lacked the care. The people here really care about their patients. If I were on Staten Island, I'd come to this hospital any day, twice on Sunday, over the other place. The other place, I was the director there for 6 years of pediatric surgery, and it's just a different corporate feel. It's just not the same. These guys care about you.
And I know we've seen it, and I've even seen it too, being on Staten Island. I mean, everybody knows everybody, so it's almost like eventually you are going to work or care for someone that that you've met, that lives out here. And I don't think you get that anywhere else, really. You don't.
Go with Brian McMahon, chief chairman of pediatrics. He played ball here. He grew up here. He knows. He can tell you where the nurse lived when she was in grade school, and what class she was in. It's unbelievable how many people Brian McMahon knows. And then you got guys like Messina, who played ball here, coached. He knows everybody.
Yep.
So it's a real inside game.
We had my son at St. Clair's, and he was getting his first communion this year, and all of a sudden, Rich Salhaney walks in, and he's the deacon there saying "Mex." That's all.
Yeah, that's right. It's a lovely thing to have. It's a lovely thing to be a part of. And when they brought me back, it was very special because the place is very special. So I've tried to give them 110%. I mean, I'm available, affable, and able all the time.
Wonderful. Well, thank you, Dr. Gilchrist, for all you do to keep our children safe and healthy. That about does it for this episode of RUMC Connections. Thank you for joining us. I'm Meredith Gaskins.
Thank you.